Hello, my name's Lorcan Woods, and Daniel, I think we're like the Alistair Campbell and Rory Stewart of healthcare venture capitalism. Anyway, that's how we're pitching ourselves. So what is KHP Ventures? Well, we invest in, but more importantly, we partner with early stage companies in both digital health, so kind of facing patients, in health tech, and more importantly also in enterprise software. So it's early stage companies. We typically invest up to about 250,000 pre-seed and seed, sometimes at a series A as well. And I guess the reason that I, as CFO of King's College Hospital, wanted to get into this is that we've got a strategy, our Strong Roots Global Reach strategy, which is about being bold. So it's about investing in our brilliant people in outstanding care to be leaders in research, innovation and education, and have the diversity at the center of everything that we do. And what KHP Ventures allows us to do is to increase the rate of innovation within our healthcare system, and in particular in terms of the diverse communities that we serve. We've been going now for 18 months. Daniel joined us 12 months ago. He's going to talk in a minute about how he spent his last 12 months, and because we've made a lot of progress during that time. Daniel?
Thank you. Thank you, Lorcan. My co-managing partner, Nadine Hatchacharam, and I both have spent the majority of our careers in startups. Nadine is also a practicing clinician. She's a surgeon at Guy's and St. Thomas's. Our small team really represents all the experiences that startup founders in digital health and med tech either will have or have had. And we feel that we want to be the investor that we've always wished for in our startups. And we know that the majority of our value comes after we invest. So as Lorcan referenced, we invest at a very early stage. These companies might be 5 or 6 people or even smaller. And we know that the biggest blockers to them at this early stage are access to the clinical environment, evidence generation, so supporting the case for their technologies to be integrated into the NHS, as well as access to data, clinical champions, key hires. And then sometimes it's just picking up the phone to think through a challenge about hiring, or it might be a new investor you're thinking of bringing on board. So really we've started over the first 12 months really trying to set out our stall as being healthcare experts, knowing what it's like to run and to be bold, as Lorcan said, and try to launch a new venture in digital health and med tech. And so we think this capability to support founders with all these different areas has helped us enter the market in a really strong way. We've been able to invest in 12 companies in our first year. Interestingly, 7 of those companies are run by an NHS clinician, and one of those companies is also spun out directly from King's College London. We've seen emerging themes which really match the clinical priorities of our health system, and we've seen hundreds of clinicians help us throughout the process with diligence, getting to know the founders that we're investing in before we make the decision to invest, and really helping us understand where the problems are and how those solutions might help solve them, which of course tees up really nicely what comes afterwards. Again, we know our portfolio will include companies that know our hospital system very well. We call those kind of spin-outs, if you like. But we also know that we'll have companies that have come from outside we really want to integrate into the population and into our health system. We call those spin-ins. So we work with both. And over that 12-month period, we've really seen some great results, or rather the portfolio has partnered with us to achieve some great results. We've created over 50 jobs in health tech over that period. We've redesigned at least 7 clinical pathways that we know of. So 5 of our 12 companies are currently live within South London's patch or carrying out some sort of research or validation study. We also know that our companies are working with integrated care systems all across the UK and are live in all 5 of London's ICSs right now. I think it's also important to mention that those companies are really having success commercially. And we know that a lot of that is due to the link with KHP Ventures and also how they've been able to take advantage of the clinical expertise and the validations that they've received from our cluster. So they've gone on to win over £10 million in enterprise contracts over that period, and they've won over £5 million in competitive research funding. So really, we think this is just the beginning. I'm kind of talking in a very confident and optimistic fashion because I believe in the people that we've invested in, but this is just the start of building an integrated innovation cluster, bringing together private capital, clinical entrepreneurs from KHP, from our partners, as well as clinicians and others from the health system who want to get involved in innovation in a really tangible way alongside their clinical work. So some of the things we'll be focusing on, which we know are a longer-term cultural shift, have to do with enabling more clinical innovators from within our cluster to start their own companies, to really use the founders that we've invested in as role models to support them. And yeah, continue to invest in great companies and follow on. We're really grateful for the support as KHP Ventures from our 3 institutions that have helped found us, and we're really keen to build on that and hopefully bring in other investors who are like-minded in terms of their approach to impact and achieving strong financial returns for our institutions, which allows me to turn to Lorcan. So those are really the points I wanted to cover about KHP Ventures. We're looking forward to the panel after this to discuss some of the finer points of partnership that we've seen over that period. But thank you very much for having me, and thank you very much for listening.